Welcome back to Card Zone. My name is Sergio, and I am your host. Before I get started on this week's podcast, here is my disclaimer. This podcast may discuss sensitive topics, including CSA, so listener discretion is advised. This podcast discusses experiences of abuse, violence, suicidal ideation, and CSA, which may be distressing to some listeners. The content provided is for informational and educational purposes only, and it is not, I repeat, not a substitute for professional advice. So if you or someone you know needs support, please seek help from a qualified professional or contact your local helpline in your area. Now on to week 11. Or episode 11. I'm often asked, are there different stages to the healing journey or the healing process? The quick answer, absolutely. The journey of healing for survivors of CSA involves various stages, often intertwined and not always linear. So I'm going to go over some common stages in the healing process or journey. The first one is safety and stability. So establishing safety and stability is often the first and most critical stage in the healing journey for survivors of CSA. This stage involves creating a sense of physical and emotional safety that allows the survivor to begin addressing their trauma and working towards healing. Now here's some key aspects to this particular stage. Physical safety. This involves ensuring that the survivor is no longer in immediate danger of further abuse. It may require removing oneself from the abuser, seeking shelter or protection, and taking practical steps to secure one's physical environment. Next is the emotional safety. Emotional safety is equally important. Survivors need environments where they feel emotionally supported, validated, and respected. This may also involve seeking out trusted friends, family members, or professionals who can provide understanding and empathy. Next is the boundary setting. Establishing and enforcing boundaries is crucial for creating a sense of safety. Survivors may need to learn how to recognize their own needs and assert their boundaries in relationships and in situations where they feel uncomfortable or threatened. Crisis intervention. For survivors who are in immediate crisis or facing ongoing threats to their safety, crisis intervention services such as hotlines, shelters, or emergency counseling can provide essential support and resources. Trauma stabilization. Many survivors experience intense emotional reactions and symptoms of trauma, such as flashbacks, nightmares, and hypervigilance. Trauma stabilization techniques such as grounding exercises, mindfulness, and relaxation techniques can help manage these symptoms and create a sense of stability. Accessing supportive resources. Survivors may benefit from connecting with support groups, therapy, advocacy organizations, and other resources specifically for survivors of CSA. These resources can provide validation, education, and practical assistance in navigating the healing journey. Establishing safety and stability is an ongoing process that may require time, patience, and support from others. It lays the foundation for the survivor to begin addressing the deeper layers of their trauma and moving towards healing and recovery. The next stage is acknowledgement and validation. Recognizing and validating one's experience as abuse is a significant step. The stage of acknowledgement and validation is also a crucial step in the healing journey for survivors of CSA. It involves recognizing and accepting the reality of what happened, as well as validating one's own feelings and experiences. So I'm going to go over some key aspects of this particular stage. Recognizing the abuse. Acknowledgement begins with acknowledging that the experiences of CSA occurred and it were not the survivor's fault. This can be a challenging and painful process, as it often involves confronting denial, minimizing, or self-blame that may have been coping mechanisms in the past. I went through that if you listen to my episode 3. So, validating feelings. The next is external validation. External validation from trusted individuals such as therapists, support groups, friends, or family members can also be incredibly validating for survivors. Hearing others acknowledge the survivor's experiences and express empathy and support can help validate their feelings and experiences. Understanding the impact. Acknowledgement and validation also involve recognizing the impact that childhood sexual abuse has had on various aspects of a survivor's life, including relationship, self-esteem, trust, and a sense of safety. This understanding is essential for beginning the healing process. Next is challenging self-blame. Many survivors struggle with the feelings of self-blame or guilt, believing that they somehow deserved or caused the abuse. Acknowledgement and validation involve challenging these beliefs and recognizing that the responsibility lies with the abuser, not the survivor. Affirming survivors' truth. Survivors may face disbelief and skepticism from others when they disclose their experiences of abuse. It's important for survivors to affirm their own truth and trust their own perceptions, even in the face of doubt or invalidation from others. Next is cultivating self-compassion. Acknowledgement and validation also involves cultivating self-compassion and self-kindness towards oneself. This may involve reframing negative self-talk, practicing self-care, and treating oneself with the same compassion and understanding that one would offer to a loved one. So overall, acknowledgement and validation is fundamental steps in the healing journey, providing survivors with the validation support they need to begin processing their experiences and moving towards healing and recovery. The next stage is grieving and mourning. Survivors often, this stage of grieving and mourning is a vital part of the healing process for survivors of childhood sexual abuse. This stage involves acknowledging and processing the losses associated with the abuse, as well as allowing oneself to experience and express the range of emotions that accompany grief. And here are the key aspects to this particular stage. The first is the loss of innocence. CSA robs survivors of their innocence and childhood. Grieving and mourning involves acknowledging and coming to terms with this profound loss, recognizing that the abuse has irreversibly changed their lives. Loss of trust. Survivors often experience a loss of trust in others, as well as in themselves and their own perceptions. So grieving and mourning involve recognizing the impact of this loss of trust and working towards rebuilding a sense of safety and trust in oneself and others. Loss of self. Childhood sexual abuse can profoundly affect survivors' sense of self-worth, identity, and autonomy. Grieving and mourning involve acknowledging the ways in which the abuse has shaped their sense of self and working towards reclaiming a positive and empowered sense of identity. Next is the expression of emotions. Grieving and mourning involve allowing oneself to express the full range of emotions associated with the abuse, including sadness, anger, guilt, shame, fear, and confusion. This may involve crying, journaling, talking to a trusted individual, or engaging in a creative form of expression. Honoring the pain. Grieving and mourning involve honoring and validating the pain and suffering that the survivor has experienced as a result of the abuse. This means allowing oneself to fully feel and process the pain rather than suppressing or denying it. Navigating the triggers. Survivors may encounter triggers, reminders of the abuse, that intensify their feelings of grief and mourning. Navigating triggers involves developing coping strategies and self-care practices to manage these intense emotional reactions and prevent re-traumatization. Acceptance of loss. Grieving and mourning ultimately involve coming to a place of acceptance regarding the losses associated with the abuse. This does not mean forgetting or minimizing the impact of the abuse, but rather finding a way to integrate these losses into one's life story and move forward with resilience and strength. Seeking support. This part I'll never say enough. Grieving and mourning can be a difficult and overwhelming process, and survivors may benefit from seeking support from therapists, support groups, or trusted loved ones who can provide validation, empathy, and guidance through the healing journey. Overall, grieving and mourning are essential steps in the healing process, allowing survivors to acknowledge and process the profound losses associated with CSA and move towards healing and recovery. The next stage is self-compassion and forgiveness. Self-compassion and forgiveness are significant stages in the healing journey for survivors of childhood sexual abuse. These stages involve cultivating kindness and understanding towards oneself, as well as navigating the complex process of forgiving oneself and others for the harm that had been inflicted. Here are some key aspects to this particular stage. Self-compassion. Self-compassion involves treating oneself with kindness, understanding, and acceptance, especially in the face of pain, suffering, and mistakes. For survivors of CSA, self-compassion can be particularly challenging due to the feelings of shame, self-blame, and low self-worth. However, learning to be gentle, supportive towards oneself is essential for healing. Cultivating self-love. Survivors may have internalized negative beliefs about themselves as a result of the abuse, such as feeling unworthy, unlovable, or damaged. Cultivating self-love involves challenging these beliefs and recognizing one's inherent worth and value as a human being, regardless of past experiences. Next is letting go of self-blame. Many survivors of CSA struggle with feelings of self-blame, believing that they somehow deserved or caused the abuse. Letting go of self-blame involves recognizing that the responsibility for the abuse lies with the abuser, not the survivor, and releasing oneself from unjustified guilt and shame. Next is practicing self-forgiveness. I need to practice this one. Self-forgiveness is a complex and deeply personal process that involves acknowledging one's mistake and shortcomings, accepting responsibility for them, and choosing to forgive oneself for any perceived faults or wrongdoings. This can be particularly challenging for survivors of CSA, who may blame themselves for not preventing or stopping the abuse. However, self-forgiveness is an important step towards healing and letting go of the burdens of the past. Next is setting boundaries. Practicing self-compassion and forgiveness also involves setting healthy boundaries to protect oneself from further harm. This may involve establishing boundaries in relationships, saying no to situations or people that are triggering or harmful, and prioritizing one's own needs and well-being. Extending compassion to others. Alongside self-compassion, survivors may also benefit from extending compassion to others, including the abuser or abusers. This does not mean condoning or excusing the abuse, but rather recognizing the humanity and inherent worth of all individuals, even those who have caused harm. Seeking support. Can't say this enough. Self-compassion and forgiveness can be challenging to cultivate alone, and survivors may benefit from seeking support from therapists, support groups, or trusted loved ones who can provide guidance, empathy, and validation throughout the healing journey. Overall, self-compassion and forgiveness are essential stages in the healing process for survivors of CSA, allowing them to cultivate kindness and understanding towards themselves and others, and move towards healing and recovery. The next stage is understanding and integration. Understanding and integration are crucial stages in the healing journey for survivors of CSA. These stages involve gaining insight into the impact of abuse on various aspects of one's life and integrating these understanding into one's sense of self and overall life narrative. So here are some key aspects to this particular stage. Understanding the impact. Understanding involves gaining insight into the ways in which childhood sexual abuse has influenced one's thoughts, feelings, behavior, and relationships. This may include recognizing patterns of coping mechanism such as avoidance, disassociation, or self-destructive behaviors that have developed as a result of the abuse. The next is processing emotions. Understanding and integration require processing the intense emotions associated with the abuse, including sadness, anger, shame, guilt, and fear. This may also involve exploring the underlying causes of these emotions, as well as finding healthy ways to express and release them. Next is exploring the triggers. Survivors often encounter triggers, reminders of the abuse, that evoke intense emotional reactions and distress. Understanding and integrations involve identifying and exploring these triggers, as well as developing coping strategies to manage them effectively. Next is the recognizing of the maladaptive patterns. CSA can lead to the development of maladaptive patterns of thinking, feelings, and behaving that persists into adulthood. Understanding and integration involve recognizing these patterns and their origins, as well as challenging and changing them to promote healing and growth. Next is the development of self-awareness. Understanding and integration requires developing self-awareness and insight into one's thoughts, feelings, needs, and behaviors. This may involve practices such as mindfulness, journaling, therapy, and self-reflection that fosters greater awareness of oneself in one's inner experiences. Integrating the past. Integration involves incorporating the experiences of CSA into one's overall life narrative in a way that feels coherent and meaningful. This may involve acknowledging the ways in which the abuse has shaped one's identity, beliefs, values, and relationship, as well as finding a sense of purpose and meaning in the midst of the pain. Next is finding meaning. Finding meaning, survivors often seek to find meaning in their experiences of CSA, despite the profound suffering it has caused. Understanding and integration involve exploring questions of meaning, purpose, and spirituality, as well as finding ways to use one's experiences to promote healing, growth, and positive change in oneself and others. Next is seeking support. Understanding and integration can be a challenging and overwhelming process, and survivors may benefit from seeking support from therapists, support groups, or trusted loved ones who can provide guidance, empathy, and validation throughout the healing journey. Overall, understanding and integration are essential stages in the healing process for survivors of childhood sexual abuse, allowing them to gain insight into the impact of the abuse and integrate this understanding into their sense of self and overall life narrative, ultimately promoting healing, growth, and transformation. And now, as we come to the end of today's episode, I want to extend my deepest gratitude to each of you for joining me this week in this important conversation about childhood sexual abuse and the various stages of healing, Part 1. Again, Part 2 will be out next week. I know it's not an easy topic to discuss, but I'm trying to shed light on these issues, and we're taking steps towards healing and understanding. To all the survivors out there who are listening, your strength and your resilience inspires us all. Remember, you're not alone, and there is hope for healing. If you need to, please reach out. So let's continue to support and uplift each other as we navigate our individual journeys. Thank you for lending your ears and hearts today. So until next time, take gentle care of yourselves.